Sun Safety Health Education Seminar. Notice: the information presented in this presentation is for informational and educational purposes only and should not be used to diagnose or treat any known or unknown medical symptoms or conditions. If you are experiencing any signs or symptoms of illness or think you have a medical condition, it is recommended that you consult your physician. Today, we'll talk about why sun safety is important to you, provide you with the facts, go over what it means to you, provide you with quick tips, an overview of your wellness tools, and your next steps. Quick poll. True or false? Overexposure to sun can result in skin cancer later in life. This is true. The dangers of UV exposure include that on average, children receive 3 times more exposure than adults. Concrete, sand, water, and snow reflect 85% to 90% of the sun's UV rays. You can sunburn even on cloudy days, and reduction of the Earth's ozone does increase your exposure to UV rays. More than 1.2 million new cases of skin cancer are diagnosed every year in the United States. In some parts of the world, melanoma is increasing at rates faster than any other cancer. One serious sunburn can double a child's risk of developing skin cancer. Melanoma, the deadliest form of skin cancer, kills 1 person every hour. People of all races can burn. Certain skin types are at higher risk. Skin cancer affects everyone. UV rays are invisible and dangerous. UV or ultraviolet rays are the sun's invisible burning rays. They can cause sunburns and in some cases skin cancer. There are 3 types of UV rays. UVA are more constant year-round and penetrate deeper into the skin's layers. UVA rays are also harmful and contribute to burning, premature aging of the skin, and the development of certain forms of skin cancer. UVB are the primary cause of sunburning, premature aging of the skin, and the development of skin cancer. UVC are blocked by the ozone layer and do not reach the Earth's surface. The more intense the sun, the greater the exposure. UV is greatest when the sun is at its highest in the sky and less in the early morning and late afternoon. UV exposure is the greatest in the summer in the United States. UV exposure is greater in the mountains than in the valleys and is strongest at the equator, but gets weaker as you move toward the poles. The longer you are out in the sun, the more UV rays you receive. It's important to know your UV index forecast. You can look this up on most weather channels and most news stations. It's important to know your exposure category and the UV range so that you know what the sun should be like that day and protect yourself because of this advisory. The UV index scale can help you prepare for your need of UV protection. 2 or less, as we looked at a minute ago, is considered low. This is when you can wear sunglasses, cover up, and use sunscreen if you burn easily. 3 to 5 is considered moderate. You have a risk of harm, so take precaution and cover up. Stay in shady areas when possible. 6 to 7 index scale indicates high, and this is when you need to apply a sunscreen of at least SPF 30 and wear a hat and sunglasses at all times. A UV index scale of 8 to 10 is very high and definitely a risk. You must apply 30 plus SPF sunscreen regularly to be protected, and wear protective clothing and sunglasses. This is when you want to take extra precaution. UV index scale 11 is extreme and the most important to try to avoid and just be aware of. So this is when you want to avoid sun exposure, specifically between 10 a.m. and 4 p.m. Seek shade, cover up, use sunscreen, and wear a hat. Are you at risk for skin cancer? People of all races can burn. There are several different factors that could increase your risk. These include spending long periods of time in the sun, having fair skin, having severe burns from the sun, x-rays, radiation, or tanning beds, an appearance of moles, having a weaker immune system, living in the sun belt or at high elevation, and having a family history of skin cancer. So how is skin cancer detected? Perform a self-exam. Look over your skin for any changes, such as size, color, texture, or shape of a dark spot or a mole, and check for new moles and any bleeding associated with them. Check any unusual bumps or growths you might have. And if you have any of these above symptoms or anything out of the ordinary, show your physician or a dermatologist as soon as possible. Heat stroke is the most serious form of heat-related illness. When the body is unable to regulate the core temperature, you might have heat stroke. Sweating stops and the body cannot rid itself of heat. Signs and symptoms include confusion, loss of consciousness, seizures, and heat stroke is a medical emergency and could possibly result in death. So what you should do is go into the shade and cool down with water. Monitor body temperature until between 101 and 102 degrees Fahrenheit. Seek medical assistance as soon as possible. Heat exhaustion warning signs can include heavy sweating, paleness and tiredness, headache, dizziness, weakness and fainting, nausea or vomiting, and muscle cramps. What to do in this situation is drinking a cold, non-alcoholic beverage. Be sure to get plenty of rest. Take a cool shower or a bath. Use lightweight clothing and get into an air-conditioned environment sooner than later. Heat cramps occur with those who sweat a lot during strenuous activity. This sweating depletes the body's salt and moist. Heat rash is a skin irritation caused by excessive sweating during hot weather. Generally, this includes a red cluster of small blisters. For heat cramps, stop all activity and sit down. Drink a sports beverage or clear juice. Do not resume activity for at least 3 hours, and seek medical attention if they do not subside within an hour. What to do with heat rash is be sure to get to a cooler environment whenever possible. Keep the area dry. Powder can be used for comfort. It's important to protect your eyes. Sunlight can reflect off snow, sand, and water. UV radiation from reflection can increase your risks. To protect your eyes, follow these guidelines. Look for sunglasses with 99 to 100% UV protection. The price does not ensure the best protection. Ask eye care professionals to test your sunglasses. People with contacts should be wearing sunglasses. Wraparound sunglasses offer the most protection. Children need sunglasses with UV protection. It's important to wear appropriate clothing. Choose lightweight, light-colored cotton clothing. Synthetic materials keep in body heat. Wear a wide-brimmed hat in the sun for protection. Wear shoes that allow feet to breathe. For children, be sure to dress infants and children in cool, loose clothing. Shade their heads and faces with hats or an umbrella, and cover in sunscreen if they are exposed to the sun. Let's talk about vitamin D. Vitamin D is the sunshine vitamin for good reason. UVB rays absorbed in the skin actually produce vitamin D. So why do we need vitamin D? This promotes calcium absorption, and this is needed for bone growth. Vitamin D also assists in cell growth and immune function, and reduces your risk of osteoporosis. The amount of vitamin D you get from the sun depends on the time of day. The middle of the day is the best time, where you live, so the closer to the equator, this can increase the vitamin D absorption. The color of your skin, pale skins make vitamin D more quickly, and the amount of skin you expose is important. You don't need to tan or burn your skin. A short amount of time in the sun will be sufficient. Sunlight can actually improve your mood. Sunlight increases endorphins and serotonin. It balances out hormones, and it can lower pain levels of arthritis and swollen joints. Sunlight can reduce risks of certain cancers, specifically breast, colon, and prostate cancers. Sunshine improves circulation. It stimulates your red blood cells and oxygen in the blood, so don't be afraid of the sun. Proper hydration should get some attention too. Increasing fluid intake protects against heat-related risks. It's important especially during hot and humid weather. Don't wait until you're thirsty. Avoid caffeinated liquids, alcohol, or sugary beverages. It's important to drink plenty of water, particularly important for people over 65, for infants, and for children. People who are overweight need more water. Begin hydration a few hours before being active. During heavy exercise, drink 2 to 4 glasses of cool fluids hourly. Remember to drink lots of cool fluids after exercise. And did you know eating fruit is another way to stay hydrated? Be sure to use the Fruit and Veggie Tracker and the Water Tracker on your wellness website. These trackers can help you to increase your water and increase the amount of fruit and vegetables that you're consuming on a daily basis. The sun is strongest between 10 a.m. and 4 p.m. When it's very sunny and hot outside, wear clothing that's dark and tightly woven. Wear a wide-brimmed hat and sunglasses. And remember that UV rays bounce off sand, snow, concrete, and water. Don't use sun tanning beds whenever possible. Keep very young children, 6 months or less old, out of the sun. And sunscreen needs to be applied liberally and evenly over all exposed areas. What's your next step? For children, the SSA recommends sunscreen with an SPF 30 or higher. Apply sunscreen before going outdoors and reapply often. Reapply sunscreen after swimming, perspiring, and toweling off. Provide complete sunscreen coverage for your skin, including neck, ears, and lips. Be sure to stay hydrated, especially during hot days. And remember, stay in the shade whenever possible.